Yeah, we spend a lot of time on skin, being the largest organ in the body. This is interesting. These measurements we're doing, like if you're wondering about your skin age and you get these kinds of measurements, it brings it to life for you. It shows you what the naked eye can't see.
It's pretty scary. Yeah.
This is how I got my kids to wear sunscreen.
There's actually a study on that this type of UV hyperspectral imaging methodology does increase sunscreen adherence. See why?
Yeah, like that, like a zombie face.
Holy shit.
That's another one. We're using autofluorescence for skin measurement.
Measures, says the advanced glycation end products accumulation in the dermis, mostly specifically. Just increases from age 5, that marker. It's progressive things. Yeah, clinically validated as well in diabetics.
So we have here, we're doing IPL. So we have two lasers, two systems at the clinic. One is IPL and one is laser system, 532 nanometers and 1060.
Yeah, basically for skin rejuvenation, you need a lot of different wavelengths and a lot of different pulse widths. And also depends on the individual as well. So some people can't tolerate something, or light-based therapies they just don't tolerate in general. But yeah, it's like you need a lot of different things to cover all the markers on skin in a time-efficient manner across the whole body. Because people just rejuvenate their face, and that's only 3% of body surface of skin surface area, and that's not going to have a systemic effect really. But we don't skip anything, even backs of ears and soles of feet and palms of hands and fingernails and toenails and all that stuff.
And this particular technology was shown to change genetic expression. So you're not just looking; it's not like a Botox or a filler. You're actually changing genetic expression with this therapy.
Massively reverses collagen loss in the dermis as well, which drops about 50% from age 20 to 80 for type 1 and type 3 and the ratio as well. And it's not great for wrinkles, that one. Laser and microneedling and stuff are better for that. And lots of different topics. Yeah, LED, 630, 830 nanometer eye jewels are also good for wrinkles and recovery post IPL or laser or microneedling, etc.
This is twice a week, 12 minutes each side.
Yep. Yeah, it's like cooking your entire body, but without not the old school way where they did UV light and that actually just increases aging. You get those dimer mutations in all your skin cells, which is very bad, skin cancer. But this is pro-regenerative, and not just for the skin, because the wavelength penetrates quite deep. You get MSK and brain benefits as well. Some interesting studies on brain aging, on transcranial Doppler, RCTs, and depression, anxiety, traumatic brain injury, white matter hyperintensities, et cetera, just from LED light.
And we've seen dramatic changes with the improvements we've made. And so since we started measuring my brain with white matter hyperintensities, the markers went down from age 69 to 48 in 8 months' time. Yeah,
and it was stable before because it was like 3 or 4 MRIs, then a personalized protocol to reduce that. And that's a fundamental aging marker that isn't normally considered reversible, except if you have like MS, relapsing remitting MS. But then it's more of like a level 2 autoimmune disease rather than an intrinsic aging.
We also mentioned that the pills that we showed a second ago, we stopped doing those because we do so many measurements to see what's working and what's not working. We couldn't find efficacy with the pills, so we discontinued that. We're still doing IPL, laser, LED.
That's the thing. Everyone's like, oh, you can't establish causality from multi-component interventions at n=1. And it's like, you can really. Like, if the effect size is large enough and you do timings, and what the expected endpoints are at each time point, you can whether it's working or not with quite high causality likelihood.
This year we're doing patch testing of various settings of the laser, and we learned why that's important because I guess 10 days ago we increased we put more power in on the settings, and I had a reaction. I got burned a little bit. So it's fine. It's not a big deal. It's going to.
Yeah. It's good. No one's ever done it before. This such an extensive protocol, particularly on the body. It was mostly done on the face. This pulse width, joules, and wavelength combination. But yeah, patch test. No one ever patch tests properly that I've seen.